Hi, I'm here with Alvaro, Pascual Leone, and Alvaro is a professor of neurology from Harvard. And we've been talking today here at Positive Science about issues that relate to brain plasticity science. And Alvaro's been a leader in this science as it relates to human studies and to human remediation. And one of the things that he's developed in his own research and heavily exploited has been the use of direct brain stimulation, usually applied magnetically. And I thought it would be really interesting if you could tell us a little bit about the ways in which you have used it most effectively clinically in applying magnetic stimulation and the impacts that it's had on the patient population that you treat, and how you interpret in terms of brain plasticity mechanisms or processes.
So, I mean, the idea behind the whole approach is the fact that the brain ultimately is an electric organ. Lots of electric connections passing electricity through each other. And so if that is the case, then maybe introducing electricity as a means to modify that activity might be a direct and particularly immediate step to try to influence function. Of course, the challenge is that the brain is encased in this great isolator that we call the skin and the skull. And so to get electricity in, normally you need to open up the skin and the skull and introduce an electrode. But magnetic simulation offers the opportunity of using the magnetic fields to bridge through the skin and the skull and induce a current in the brain.
I might say, just to interrupt you for a minute, that there are a long series of studies which indicate that we know this is painless, and it's also, there are a long series of studies that indicate that this is safe. I mean, there have been no real untoward indications that this generates harm in any way, and lots of indication that it can generate benefit.
That's correct. If people follow appropriate safety guidelines, which have been developed now over 15 years ago, 20 years ago, and have been endorsed by a number of international societies, then it is safe, it is well tolerated, and there are no immediate nor long-term risks. But it needs to be applied appropriately, otherwise you can induce havoc, as it were. You can induce a seizure, because you can introduce too much electricity, as it were. So you need to do the right thing and know what you're doing. But if you do, then you can ultimately envision the possibility of taking an area of the brain that is not functioning properly and modify it in such a way that you induce an improvement in its function. And the result of that can be a therapeutic benefit for a patient. The majority of the applications that have been done have been in patients with neurologic and psychiatric disorders. So patients with depression, for example, we know have dysfunctions in specific areas of the brain that form a network that involves frontal areas, as well as subcortical areas. Why it comes to that dysfunction, we don't know. But if you can modify the activity in that circuit, you might be able to force it to work in a more normalized way, and that may translate into a benefit of the patient.
Now, you initially applied the stimulation because you found areas in the brain that you could stimulate in the frontal cortex in the brain, for example, in depressed patients, in which patients basically felt more alive, felt more engaged. And then you found that if you stimulated those areas chronically over a period of days, a period of weeks, that you could have enduring effects in which people felt more alive, more engaged. And
that's precisely right. And that's what essentially we think of plasticity guiding intervention, right? Because what we find is that we make an intervention, it changes the way the brain is functioning, but by repeating that intervention over time, not only does that modification become more established, but also then lasts on beyond the stimulation sessions themselves for weeks and months. And so that opens up the opportunity to really develop it as a therapy, where you can apply the stimulation and then have some sort of maintenance schedule, but where the patient in between is functioning normally.
Now, this science is still in its relatively early stages of development. You don't always understand exactly how to account for the effects that are recorded. So in the case of depression, you could say, you might imagine that it's having a direct and local effect on the stimulation target, or you might imagine that you're, for example, engaging the deep structures of the brain that contribute to alertness or brightness, and you're upregulating them in some way that's making them more powerful and more active. But you don't really know
That's exactly right.
at this point how many of these effects are accounted for. And that's one of the ways that your science is being elaborated. You're trying to understand more and more how these effects are.
That's exactly right. So what we know is, and we know it from animal studies as well as from human studies, that we're modifying activity both locally
Right.
and in a network.
Right.
So we have
Right.
not only
Right.
local effect, but we
Right.
have a distant effect that is not randomly all over the brain, but specific based on the connections.
Right.
What of those effects account for a given behavioral benefit or
Right.
therapeutic benefit in any one disease, we don't know.